we're trying to get a range here. Okay, so you have an ACL tear, a medial meniscus, and an MCL sprain. Okay, so and then you have pain, you said?
So she's sort of point. It's kind of right here.
Right there. Okay.
And what number right there? That 2. we didn't work on it at all today, but yesterday the pain went down a lot. So what was it yesterday?
Like a 4 when I got it. Yeah, 4 5.
Point for me, Emily.
So if you bend your knee even farther, do you feel more pain?
I feel like a tourniquet sensation.
Yeah, so that's fine probably in there.
Yeah. So it, like just grabs.
So this is full range of motion for her here, but here, let's see how far you can go back.
Got right there, and then I start to get that.
All right, and I'll see what you got for range of motion here. Yeah, so you got only, oh, I'm sorry. You have only 102 degrees of flexion here. So let's see what we can do.
Where would you go lateral?
Yeah, I would definitely start lateral. We get the pain, and then we can treat for range right after. There you go, so something like that. She was like up higher, right? Point again.
Up right in here.
There you go, so right in there. I'll do the elbow right there. Anybody have a pen or a marker? Thank you kindly. So right there was the pain. So I had 102 degrees flexion. So it's lateral. It's a lateral elbow. So you got to flip it. Yeah, there you go. That. I would use your knuckles if she'll let you too.
Yeah.
There you go. Yeah. A little tender of a spot, but
Very
Is
tender.
that pressure okay?
Yeah.
and then I would say go ahead and bend your knee. You know?
Go ahead and bend your knees.
So it's not addressing so much the pain, but we're addressing the
Same better.
I mean we're addressing the pain.
I'm getting that same feeling, but it's.
So keep going. Yeah, keep going. Yeah, so I would do that and then move up one and then move, you know, do like a bunch of different areas.
That's crazy tender. And then I get it, but it's coming.
Point for me with your finger.
That farther. Yeah, so I
Now
would do like oh go ahead.
Getting it like more down. Yeah.
But what about here?
That I'm not feeling.
Okay, so you got that, right? Excellent. And let's check our range now. I measured, so I'll measure again here. Keep the same person. So far back as you can go.
Yeah.
Yeah, so she gained, she's at 117 now. Okay, so she was at 102 or 117. So she gained 15 degrees of range of motion, just like that. Okay, so I'm sure we could get some significant range of motion gains here, despite the swelling in her knee. So, so now you said the pain's where?
More down here.
Okay, so let's do that. Excellent. You got it.
And relaxing.
We're like anterior lateral, right? We're like right off the tibial tuberosity. So I would do like lateral. So I would do like right there. So let's find inferior knee. Yeah, so I would do like, why don't we do her anterior elbow and do like right there, you know?
Those are the
Those
spots
are the
you
fun
did well
spots.
yesterday.
Is your favorite?
They're the ones that made my knee heat up.
So she's on 28, and she went off of those two purple dots and went left a little bit, lateral. You can go ahead and bend your knee now. You're getting there. Look at that range now.
Yeah,
Same, better, worse.
I'm still getting it on the front side of the knee there.
Good. Like,
It's a little higher. Let's see. Where were you before? Where did you just stimulate?
I was over it.
You're right there. So she's like talking about here. So I would just go up a little. And then her range of motion now is at 120, right? So she's gained 18 degrees of range of motion, okay? And we're still chasing around her pain, and we've done a couple points, but she's got 18 degrees. Make sure that's flat like that. I'll give you a step stool. There you go.
Thanks.
So you can usually always increase range of motion. Always, always, always get 10 to 12 degrees of range of motion, usually anywhere on the body, because it just frees it up.
Try bending.
And try it again. What about now?
Now it's more in the joint itself, like I feel like
Ah.
I'm catching something in there.
But what about on these two, like, no pain? All right, let's test it again here. And you now have 125, and you started at 102. So she's at 23 degrees increase in range. Now, I think her other one is, you have pretty good knee.
I do.
That's really a lot. All right, so your other one's at 140.
Oh, wow.
Yeah, 130, 130, I would say I would say 130, 136. So you're about, yeah, about 10, 11 degrees. Jeez, my goodness. Okay, so let's free it up now. Let's do the whole, let's do all of that, right? And then her whole lateral and her whole medial. So I would do like all in here, all in here, all in here, all in here, and see if we can gain more range.
Just in that position.
Does it matter the position of her leg?
Well, she's doing anterior elbow now, so we'll see. We'll see how it goes. She's just gonna like blanket her entire elbow.
Keeping it in this position.
Yeah, or you can turn it out, depending on how you want to do it. But
I'm pretty sure yesterday when we got right here, we were just doing this
Yeah,
area.
inside.
Yeah.
That's iron.
so keep those thumbs that flat like that. Like that. You go
Oh,
like that.
this.
Yeah, there you go. Bless you.
Thank you.
So I bet you if we did like 3 other body parts and did all that referral area, I bet you we could get her close to full range of motion.
That looks.
And that is
Yeah, and
pretty-
it's in the knee itself that I'm feeling.
yeah, she's got an internal derangement, so that's 120, 126. So she's got about 127. So she's got 25 degrees. Yeah, 25 degrees now increase in range of motion. Awesome. Yeah, I mean,
Cool.
yeah.
That was pretty good.
I bet you if we stayed longer, we could get, the other 9 degrees or so, or 10 degrees. But awesome, great.
Good job.